So I will show you the measurement of the graft length. Total length of this graft is around 11.5 centimeter, good enough for me. And if you will ask to measure the length of the patellar bone block, that is around 3 centimeter, 30 millimeter, and 25 millimeter is always good. And this is the patellar side, this is around 25 millimeter. So tibial side 30 millimeter or patellar side it is 25 millimeter. Hello friends, today we are going to demonstrate the surgical technique of harvest of the bone patellar tendon bone graft for the anterior cruciate ligament reconstruction. See, certain indications for the PTB graft are still there in the clinical situations, clinical scenarios where the patient is very active and he or she is participating in the high demand sports, athletes. In such scenarios it is better to do the anterior cruciate ligament reconstruction with PTB graft, as the healing potential of the PTB graft is better than hamstring graft. So I am going to demonstrate the surgical technique how to harvest the PTB graft with easy approach. I have done the diagnostic arthroscopy with the standard anterolateral viewing portal, and this is the working portal, anteromedial portal. I am keeping my portal slightly oblique so I can negotiate the anatomical footprint of the anterior cruciate ligament on the femoral side. So this portal usually I keep oblique. So this is the tibial tuberosity, and this is the joint line, this is the joint line, this is the patellar tendon. So this is the standard position of the knee arthroscopy. It's a supine position. I usually keep the knee in 90 degree of flexion. This is the left knee, and the surface landmarks are this is the tibial tuberosity, this is the tibial tuberosity, this is the patella, this is the patella, this is the medial joint line, this is the medial joint line, this is the lateral joint line, this is the lateral joint line, and this is the patellar tendon. This is the patellar tendon. So width of the patellar tendon, as we all are aware that length of the patellar tendon is around 4 centimeter and width of the patellar tendon is around 3 centimeter. So we will divide the patellar tendon in 3 parts: middle 1/3, medial 1/3 and lateral 1/3. And for this graft harvesting we take middle 1/3 of the patellar tendon with the part of the patella and the part of the tibial tuberosity as a bone chunk. So I will keep my incision slightly oblique on the medial aspect of the tibial tuberosity and patellar tendon. This is my incision. This is my incision, around, you can say around 6 centimeter long incision, obliquely situated on the anteromedial aspect of the proximal tibia, patellar tendon and tibial tuberosity. So I am putting my incision with the help of skin knife. This is the skin incision. Forceps. Deep dissection, deep dissection, cut the deep fascia. Retractor please, cut the deep fascia. With the help of dissecting scissor, I am shifting towards the patellar tendon. Now my patellar tendon is totally exposed. The deep fascia. So I would like to locate the medial edge of the patellar tendon. This is the medial edge of the patellar tendon, and this is the lateral edge of the patellar tendon. So these two margins always one should keep in mind, and on the basis of these two margins I will locate or identify the middle third of the patellar tendon. This is the middle third of the patellar tendon. With the help of marker I will put the marking. The medial edge, the medial lateral edge, or you can say this is the middle 1/3, center of the middle 1/3. So I will put incision on the center of the middle 1/3 of the patellar tendon, starting from the tip of the patella, and keep the incision very superficial. So I am going to cut the paratendon only, not going deep to that. This is the paratendon. I am cutting and coming down. So I had cut the paratendon from the tip of the patella up to the tibial tuberosity. This is the paratendon. This is the paratendon. So incision in the paratendon is made, and paratendon is elevated from the patellar tendon medially as well as laterally. So I will use this layer for the closure after harvesting the middle third of the patellar tendon. So chances of the anterior knee pain will be less in the postoperative period. So this is the medial edge, this is the lateral edge, and marker, scale enough. So I am going to take middle 1/3, that is around 10 millimeter wide. The medial edge, so lateral edge, this is the center. So I will keep my scales marking 5 millimeter in the center of the middle third, and mark on the either side of this marker. So this is the 10 millimeter width which I am going to harvest. Towards patella, we had marked done. So from the tip of the patella on the marking, the deep through and through the width of the tendon, I am placing the incision through the patellar tendon coming towards the tibial tuberosity up to 20 to 25 millimeter on the tibial tuberosity. On the other side, same process I am doing. Middle 1/3, that is having around 10 millimeter width. So this is placed. The center 1/3, that is around 10 millimeter width of the patellar tendon, I had incised by putting 2 vertical incisions, and after that I will cut the tibial tuberosity in the oblique fashion. So I will able to harvest the tibial bone of the tibial tuberosity, that is in trapezoidal that shape. So around 20 to 25 millimeter long incision made in the periosteum of the tibial tuberosity to harvest the bone part of the tibial tuberosity side. So I will keep the angle of the saw around 45 degree. So the tip on both sides, medial and lateral cut, will meet on the apex of the trapezoid. I am going around 10 millimeter inside the bone. Host it on. I will cut the remaining attachments of the bone to its parent bone. I think you can able to see the mobility of the bone of the patellar tendon, tibial tuberosity. Will cut the tip of the bone plug with the help of osteotome. Now you can able to see very good in front of the knee joint, so you can manage the harvest of the patellar tendon with smaller incision easily. There is no need to put the long incision. Cut with the help of oscillating saw. Lateral side I have done it completely, and I am cutting it on the medial side. Now you can see the harvested part of the graft. This is the tibial side, tibial bone block, that is around 25 millimeter long, and this is a patellar bone block. This is also around 25 millimeter long. So I will show you the measurement of the graft length. Total length of this graft is around 11.5 centimeter, good enough for me. And if you will ask to measure the length of the patellar bone block, that is around 3 centimeter, 30 millimeter, and 25 millimeter is always good. And this is the patellar side, this is around 25 millimeter. So tibial side 30 millimeter or patellar side it is 25 millimeter. So you can able to see that I had closed the peritoneum very meticulously, and it all depends upon the technique of your incision in the peritoneum. If your incision is proper, you had separated it very precisely from the underlying tendon substance, you can close it very accurately, as we can see in this case. 5.5 centimeter only for this PTB graft harvesting procedure. Thank you very much.